Steve McCabe.
Often, Mr Speaker, the NHS estimates debate is a rather perfunctory affair, but this year, 5 years into the reign of the present Secretary of State, we are entitled to ask what on earth is happening to our NHS and social care system, and can we any longer afford the extraordinary complacency of this government? As an opposition MP, I sometimes worry that either by design or simple neglect, they'll finally fulfil many of our worst fears that the Tory party is destined to destroy the NHS. Well, I don't think I need any lectures on cross-party dialogue from the party of the death tax and the £8 billion financial fib, Mr Speaker. In Birmingham, we've seen 28 million of cuts to the budget for social care, bringing the service to its knees. Elderly people being treated like cattle, lying around in trolleys, waiting in corridors, dispatched from hospital in the middle of the night. Everywhere we look, we see our hospitals, GPs and social care services collapsing under the strain. This Secretary of State is quite happy to flex his muscles when it comes to bullying junior doctors, but it's always someone else's fault when it comes to resources, management and administration of the NHS. There was a time when the deal was simple. In return for the red box and ministerial salary, ministers took responsibility. The buck stopped with them. But no more. I've lost track of how many parliamentary answers begin with the words, "The department does not collect that data centrally," or "it would not be cost effective to provide information in that format." Basically, ministers don't know and don't want to know and don't want us to know what's really happening. They're no longer presiding over a genuinely national health service, whether it's the postcode lottery that characterises the provision of IVF, with clinical commissioning groups ignoring NICE guidelines and making up their own criteria as they go along, or children's dentistry, where there's a growing crisis and a heavy reliance on hospital emergency surgery because of the lack of provision and monitoring of proper dental services for children. All this government wants to do is hide behind and blame others for their shambolic decisions. The latest disaster is the business rates revaluation, which in Birmingham, it's estimated, will see a rise for the Queen Elizabeth UHB Hospital from 2.8 million to 6.9 million per year. Talk about robbing Peter to pay Paul. And yet ministers from the DCLG and Health haven't even met to discuss this problem. I do know that private hospitals get an 80% reduction because they're registered as charities. In my own constituency of Selly Oak, we've been fighting a battle to save our Katie Road walk-in centre for several years. We've had stop-go consultations, money wasted, explanations and excuses that vary from month to month, consultations announced and then scrapped, and now we have the sustainability and transformation plan that sadly, as has been acknowledged, has turned into a secret strategy drawn up by non-elected bureaucrats from which the public and their elected representatives have been largely excluded. It seems that Katie Road is now caught up in this fiasco, and with its contract scheduled to finish on the 31st of next month, we still don't know what's happening. Although if rumours are true, even more money that ought to be spent on healthcare in Birmingham is about to be siphoned off to rescue bankrupt neighbours. Only the other week, I discovered that the contract for South Maple GP services is to be cancelled. Apparently, it's no longer cost-effective. Not cost-effective to provide GP services to the sick and elderly. Only under this Secretary of State could the NHS have come to this. I'll give way.
I'm very grateful to you.
In my remarks, I was talking about a cross-party conversation. I mean, if we had this kind of conversation, I could easily point to the fact that between 2011 and 2014, there's an 8.6% real terms drop in health spending in Wales under the Labour administration, while there was a 4% increase in England. Wouldn't we be better having a constructive conversation about how we take the NHS and social care off the front page of the tabloids and sit down and work out a solution together?
It's not going to embarrass you.
Mr. Speaker, it's always desirable to have that conversation when the Tories are in power. When Labour are in power, we talk about death tax campaigns and we hear about 8 billion funding fibs. It's always funny how the argument changes when they're responsible. Now, as I was saying, Mr. Speaker, they're about to withdraw the contract for South Maple GP services. I found out, not when the Clinical Commissioning Group, who it turns out have been ruminating on this since November, told me, but when I was contacted by anxious constituents who just found out they were being given 8 weeks to find a new GP. Many of them are elderly people. Some have long-term conditions and rely on regular medication, but they're dismissed as if they don't matter. The loss of their GP service is treated like the closure of a local hairdresser or petrol station. They're told they should shop around. Apparently the CCG thinks there are enough GPs in the area. Enough at any rate to satisfy their little diagrams and tables on their secret little plans. Reducing demand for acute care is one of the government's plans to ease pressures in the NHS. Exactly how do we achieve that? By closing walk-in centres and GP surgeries. Isn't that the fastest route to the already overstretched A&E departments? It's not just the estimates which are at issue here, it's a proper long-term plan for the NHS and social care. This Secretary of State has failed us. His stewardship is a disaster, and rather than accept more of it, this House should be calling for a motion of censure. This is a government and Secretary of State who are presiding over the steady dismantling of the country's greatest peacetime achievement. It's a total disgrace.